Hello, everybody. Welcome and thank you for joining us for today's National Alzheimer's and Dementia Resource Center webinar series, sponsored by the Administration for Community Living and hosted by the American Society on Aging. My name is Julia Burrows. I'm a program coordinator with the American Society on Aging. Thank you again for being here. We will be getting started in just a moment, but before we do have a few housekeeping notes. We want to let everyone know that the slides for today's presentation are available under the tab on your screen labeled Resources. There's also another tab labeled CE Application here. This is where you'll find information on how to obtain CE credit for this event. You'll also have 60 days to complete a continuing education application, and it will take 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is if you're watching as part of a group and did not log in using an individualized confirmation URL, you will not be eligible for continuing education credit because we have no way of tracking your online attendance. If you would like to receive that CEU credit, please be sure to register and log in using your own confirmed URL. If you have any questions during today's presentation, you can send those at any time using the questions box, and we will use the last 10 to 15 minutes of today's program to answer those. I'd now like to turn it over to today's moderator, Sari Schumann of the National Alzheimer's and Dementia Resource Center.
Thank you so much, Julia, and thank you to all of you for joining us today for our webinar, Dementia in the Community, Intergenerational Programming aimed at engaging children, youth, and people living with dementia. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Before we start, Erin Long of the Administration for Community Living will provide a brief welcome. Erin?
Hi, everyone. Thank you so much for taking time out of your busy days today to join us for this very important webinar. I want to, on behalf of ACL, thank Al Castro, Melinda Cavanaugh, Jenna House, and Lori Resnick for taking their time to share with all of you and us what they've learned through their ACL-funded grant programs. With that, I will send you back to Sari and we'll get the show on the road. Thanks.
Great. Thank you so much, Erin. As you heard, today we have 4 presenters who I will briefly introduce prior to their presentations. Mr. Al Castro is Director of Health Research at the United Community Center, a large Latino-serving nonprofit organization in Milwaukee, Wisconsin. He leads and develops relevant health research studies and health education programs in collaboration with academic and/or governmental partners. We also have with us today Dr. Melinda Cavanaugh, who is Associate Professor of Social Work at the Helen Bader School of Social Welfare at the University of Wisconsin-Milwaukee. Dr. Cavanaugh is a leading expert in young carers and principal investigator for numerous research studies on families living with neurological disorders. We also have with us today Ms. Lori Resnick, who has over 20 years experience working and supervising geriatric case managers in the private, nonprofit, and philanthropic sectors. In her current role at One Generation, Ms. Resnick oversees the implementation of their special grants programs, including programs that address the needs of adults with intellectual and developmental disabilities who are at risk of or have Alzheimer's disease or dementia. And lastly, we have with us Ms. Jenna House, who is President and CEO of One Generation. She directs One Generation's Senior Enrichment Center and Care Management Program, working alongside executive leadership to assist with the growth and development of One Generation while also overseeing community-based programs. At this time, I'll turn the presentation over to Mr. Al Castro to begin.
Thank you very, very much. Buenas tardes, everybody. We're here to share our experience in having developed a pilot program, you might say, targeting Latino youth that are living with or involved in the care of an adult and their family with dementia, and we'll get into the whys a little later. But this is a program we ran this past summer as part of the ACL grant that we were just wrapping up. And we're here to share this with you, and hopefully something you can take away with you. Our learning objectives are up on this slide. Primarily, it's to help you understand a little bit better about how Alzheimer's disease and related dementia shows up in the Latino community. help you learn how to identify children and youth that might be living in a family whose family has got dementia in their family, and help you describe the role and various roles that children and youth can play as caregivers to someone in their family. And hopefully you will be learning how to create an opportunity in your programs to develop something to support and educate children and youth that are involved in the care of somebody with dementia in their family. A little bit about us before we get into it. The United Community Center, as mentioned before, is a Latino organization in Milwaukee. We serve about 16 to 18,000 people per year. We've been here since 1970. We do it with a staff of over 400 people, probably double that of volunteers. And on your screen, you will see the various programs that we serve. We're a multi-generational, multi-service organization serving from babies in our child care center all up to older adults in our long-term care support programs, which show up at the bottom of your screen there on the last slide. And that's what we're going to hear talk about, that this project that we developed came out of the elderly programs area, specifically a project called Fortaleciendo Familias, which is a HCL-funded grant. And you will see in the programs that we provide down there include a dementia daycare center. We have subsidized housing. We also have our own diagnostic dementia clinic called the Latino Geriatric Center. This program came out of the larger project we call Fortaleciendo Puentes, which translates to strengthening bridges. This is an expansion of what we would call a continuum of dementia care for Latinos in our community. This program that we started in 2018 through the ACL grant was to expand the existing memory clinic that we call Latino Geriatric Center, that had been a clinic-based model since 2007, to add a component of a mobile memory clinic where the team is actually going into the homes in the community, doing outreach and doing in-home screenings on the spot, and then also referring them patients to our physician who comes to our diagnostic clinic. The other part of this project was to develop the skills in our staff who provide care and management for adults who have intellectual and developmental disabilities, but have also developed dementia, which is kind of a new area for us. And the third part, which is part of this presentation, was to improve and expand the type of caregiver support and education programs that exist for Latinos in our community. We're looking at the Cuidando con Respeto model, virtual dementia tour, and initially we were going to call it Para Jóvenes program. Most of these were going to be classroom-based programs, but as we all know, the pandemic changed that tremendously, so we had to make some quick changes, and Dr. Cavanaugh will talk about that in a couple of minutes. This project that we have been running has been a collaboration between us, the Alzheimer's Association, the Milwaukee chapter here, and of course the University of Wisconsin-Milwaukee as primary partners. A little bit about Alzheimer's disease in our community. You may know that the incidence of Alzheimer's disease-related dementia in our community is significantly higher than the non-Hispanic population here in America, 1.5 times higher is found in our community. We also know that over 13 million caregivers that are Hispanic or African American, about 20% are giving care for somebody with dementia in their family. We also know that among this type of caregiving group, Hispanic caregivers tend to take on higher burden care situations than compared to their non-Hispanic white caregivers. We also have a strong reliance on those cultural beliefs in our culture that depending and valuing the family system, we have a strong identity and attachment to the family, which makes it kind of a challenge to bring in outside services. And that's why part of this model was create a mobile clinic, and then more of the conversation we're going to have with Dr. Cavanaugh in a minute. We call this familismo, that reliance on the traditional family system. In answer to your question, we are located in Milwaukee, Wisconsin, the south side of Milwaukee. That's where our program operates from. Real quickly, how we came about, we are members and facilitators of what we call the Latino Aging Consortium, a coalition of providers, academic partners, community partners, where we get together every 2 months to collaborate, brainstorm, come up with to help each other out. And from this, we had the conversation from previous programs where we were seeing youth in the homes that were there when we went to see the older adult, and who were involved, we thought, in care, but nobody was speaking to them. So we brought this back to the coalition, and Dr. Cavanaugh was gracious enough to come in and do a survey of our Bruce Guadalupe School, which is one of our programs at UCC. and surveyed 8th graders. Principal didn't think it was really that important. He was kind of surprised when Melinda came back with the results saying that out of 200 youth surveyed, 71 identified as caregivers. So when the opportunity came to apply to the ACL grant, we had that background data to work with plus our previous experience. So that was kind of the genesis, you might say, that led us to the concept of developing this youth caregiver program. And with that, I'm going to turn it over to Dr. Cavanaugh. Thank you.
Thank you so much, Al. It is a pleasure. Al and I have worked together for many years, so this is a pleasure to collaborate with him. So it's really important to kind of situate what we do and don't know about children and youth who are caregivers. And when we talk about caregiving in this country, we almost always exclusively focus on the adult. But what we know is there are millions of children and youth under the age of 18, 19, even 20 who are providing care to a family member, including those with Alzheimer's and related dementia. So the research really shows us that children and youth are involved in every aspect of care, including all of those that adults are participating in. But what we know is that youth aren't always told enough about the illness, regardless of the fact that they are dressing and bathing and feeding and toileting and transferring. They don't have all the information about the illness that is present in their family member. And this is often due to shame or stigma or fear of telling information. But whatever the cause, the result is that youth are participating in care. They don't have enough education and information about the illness, and particularly in Alzheimer's and related dementia. And we see that very few of these types of programs really integrate children and youth, and specifically children and youth across very diverse populations. Which leads us to the survey that Al talked about just a moment ago. So in surveying, we had 200 youth who, with parental permission, to complete a very brief survey so as not to take up much time during the school year. Al alluded to the principals being very concerned and not thinking that really any children were participating in care. So children as young as 9 in the 4th grade, we had 200 asked a very few questions about, do they have a family member with an illness? Do they provide care? What could they tell us about the care that they provide? And a really exemplary quote is from a 12-year-old who talked to us about her grandmother with Alzheimer's. She's getting old, she needs a lot of medication, and it's nerve-wracking for that youth who has to then count out the pills and make sure that she's giving the correct amount of medication. And what you'll see to this table to the right is that children and youth as young as 9 in this particular survey are participating in a variety of care tasks. And these tasks that I put here are just a small sample of the over 15 identified tasks. So children are dressing, they're providing medication, they're doing a lot of translating, and you'll see that they're often doing it every day. But what we don't know is how they're learning or how they know what to do when it comes to the care tasks that they're providing. And in a lot of my previous research, I have asked children that, and you'll see this 11-year-old at the beginning says, well, it's important when asking about getting education and support in the care tasks. It's important because one little mistake and I could hurt her. And this is a powerful thing for a child or youth to say, but it is as powerful for adults because we know that in the adult population, when they are exposed to skills and support training, it really helps to reduce any sort of anxiety and depression. But more to the point about what this young 11-year-old is saying, that when there's not any sort of education or skill, that it really can compromise the safety of not only the person with the illness, but also might leave that caregiver at high risk for actual injury, stress, and burnout. So being able to provide information and education and skills is critical, whether it's a child, youth, or an adult. And to that end, my colleagues and I developed the Y Care program. And it's critical that this program was developed in collaboration with healthcare providers. And specifically, it was developed within the ALS community, where we met with healthcare providers. We looked at our research and we said, what do kids need? And we know that they need to be supported in peer-engaged small groups. They need to have hands-on guidance by healthcare professionals who are experts in the illness, and they need to be able to build the confidence through these various modules. Now, again, this was developed in ALS, but it was made to be modular to where we could take out the modules, switch them out, whether it's about basic care skills, communication, whatever is really responsive to that illness. And what our question at hand through this ACL grant was, how can we take something like the Y-Care program that was developed for ALS and adapt it to not only Alzheimer's and related dementia, but also to the Latino community to be really responsive. And to that end, what we did is we met with our colleagues at the United Community Center. We met with our colleagues at the Alzheimer's Association and said, what are some of the key things that family caregivers need? How can we take this education program for ALS and adapt it? And the responses were really very clear that not only does the research in young caregivers and caregiving youth tell us that they need more information, all of our colleagues and healthcare providers said the same thing. We need to make sure we're integrating knowledge of the illness. We also needed to be able to give them the opportunity to see what it's like to live with dementia. It's a very abstract term, particularly for kids, when you're living with a family member or caring for a family member who has these seemingly bizarre outbursts, or they do weird things or strange things. And so being able to let them understand what it's like. And then finally, when they're providing care, what are the things that they need, and how can we as healthcare professionals provide the support, the education, the training to be able to lessen any sort of anxiety or nervousness associated with care. My apologies, I see that a question was ALS. So ALS is amyotrophic lateral sclerosis, or also what some people think of as Lou Gehrig's disease. And the reason why this was developed in ALS or Lou Gehrig's is the extreme complications, the lack of communication, the loss of the ability to use your arms, your legs, swallowing, speaking. And so caregiving in ALS is very, very, very complicated. Not the least of which, it's just as complicated in more advanced Alzheimer's and related dementias, which makes the Y-Care program uniquely able to be adapted to the ADRD community. So one thing we did with our youth day, so it's a small group, and I'm going to get to that in a minute, but we had 5 youth. They ranged in age from 6 to 16, and all of them had a grandparent with Alzheimer's and related dementia. And to the key critical factor, it was run and developed by healthcare professionals with expertise in Alzheimer's. And you'll see that picture there. This is the very beginning of our day. And we started with knowledge, and you'll see on these white papers, we gave the youth these big white Post-its, and we said, what do you know about Alzheimer's, or what is dementia? And they were able to either draw it out or write it out, and that helped us really know how to craft the rest of the day. And in the top left-hand corner and the bottom right-hand corner, you'll see our memory clinic social worker and nurse were really acting out kind of what are some things that you see that are Alzheimer's. They watched a video from someone talking to children about what it's like to have Alzheimer's. And the best part of this section was Dr. Antuano brought 2 types of brains for children to be able to look at and touch through plastic, one that was an Alzheimer's brain and one that was a normal brain. And they got to see the actual physical difference, which was powerful for these kids. The next question was what it's like to live with Alzheimer's. Well, what we did was a virtual dementia tour, and we adapted it for children. We gave them goggles where they were kind of dark, and we smeared just a little bit of Vaseline on them to distort their vision. They wore heavy mitts on their hands to be able to really kind of struggle with those fine motor skills. And then we put headphones on them with just some slight noise to distract them a little bit. And they went into the darkened room, and they were led via their headphones by Virginia Zerpa, who is our colleague at the Alzheimer's Association, and she gave them tasks: pick up some pennies, set a table, move around the room. And the children were able to really walk out of that room and think, oh my gosh, this is what it's like to live with Alzheimer's. And it was absolutely extraordinary to see these kids go in and then out. And the last module, each one of these modules, I'll say, lasted about 45 minutes. But the last one was about caregiving. And we gave them the white papers again, and we asked them, what do you do to help take care of your family member? What do they need? What are some things that we can do? And they listed out, they talked about changing their family member. They talked a lot about cooking and feeding and outbursts and helping them get in and out of chairs. So we had multiple stations preset, obviously knowing that these are some of the primary things, and we went through each one and we talked about it. We gave the kids the opportunity to ask as many questions as they wanted, and one of the really good examples you see on the right-hand corner is when someone with Alzheimer's is trying to eat something that's the same color of the plate, they don't have that ability to really differentiate, and that depth perception goes. And children were saying it's so frustrating and there's all these outbursts, but helping them understand, put it on a different color plate. That's just one very small example that we gave them that is very hands-on. You'll see wheelchairs. We talked to them about how to safely help someone in and out of a wheelchair. And we talked about, dietary issues and healthy eating. And it was just a really wonderful, engaged, hands-on opportunity. And when we asked kids at the end of the day, we gave them another, we had a lot of those big white Post-its. We gave them another big Post-it. We asked them, what did you learn? And the biggest thing is that they learned alongside other kids like themselves. They weren't the only ones. They could ask those kind of off-the-wall questions. They could have hands-on learning about care. They could ask really uncomfortable questions of healthcare providers because they knew these people were the experts. And it was helpful to see and feel through that virtual dementia tour, as well as really seeing that brain. Like, that's what the brain looks like with Alzheimer's, and it's not some abstract thing. And it's critical for children because at the developmental stages, they need more concrete. The abstract and hypothetical comes later. So showing that brain, having those hands-on, those are really, really, really developmentally critical aspects. And challenges. We certainly had lots of challenges, and these two issues kind of go hand in hand, and they really have to do with engaging healthcare providers and families to be able to not only identify that children are deeply involved in care, that they need information about the illness, about the disease itself, but that it's okay to talk about it. And that is what some of the barriers we find in this project, and certainly I have found in my research and clinical practice over many years working with families around children and youth who are caregivers. Families often feel that kind of shame or stigma. They don't want to point out that their child's involved. They're fearful of bringing that up to their healthcare provider. Well, if we're engaging our healthcare providers to ask in a very normalized way, what are some of the things that your family does? How can we help you? That it really will help to break down some of the challenges we had to implementing this project. I mean, obviously it happened during COVID, so there were some transmission concerns, but in all, those were really the primary challenges, is getting the healthcare providers to understand that children and youth are deeply involved and it's okay to ask questions of the family, but that with the family, it's also okay to really reach out for that help. And it's particularly important if you have a child or youth who are involved in care, as we did in not only this project, but also in the previous Latino study, where out of 200 youth, 71 of them self-identified as a caregiver, and no one had really asked them that before. So we took those challenges and we said, you know what, we're not done. So our next steps are to really broaden the collaboration, and we're actually doing that right now throughout the broader Latino community, throughout the whole of Southeast Wisconsin. And we're going to be conducting not only additional sessions, but larger sessions, taking that information that they want the hands-on, they want to be with and they want to learn from healthcare providers who are experts in the disease itself. And then also being able to really dig into the research and collect some as much data as possible to really evaluate not only the efficacy, but also compare it to the data in our ALS community to really look at what are some of the similarities and differences. How can we tweak this Y-Care model even further to make it as applicable and particularly culturally responsive? So thank you. These are our kids. We had the absolute best day, and it was an absolute pleasure and an honor to work with them. As these are our references, and it is my absolute pleasure and honor to turn it over to Lori Resnick, my wonderful colleague at One Generation. Thank you all so much.
Hi, thank you so much, Melinda and Al. This is Lori. Before I begin, I want to thank those at ACL for inviting us, as well as their generosity in providing us with a grant enabling us to continue to do our impactful work. I'll be giving you an overview of our organization and the importance of intergenerational programs, and then I'm going to pass the baton to my colleague and CEO, Jenna House, to discuss the details and implementation of intergenerational programs. So at One Generation, our mission is to support and enrich the lives of older adults, children, and families throughout our diverse community. Our vision is a kind and an equitable community enriched in intergenerational relationships, thriving with dignity, quality, purpose, and security. So a little about One Generation. We're a nonprofit organization offering a wide variety of services to families throughout the Los Angeles County. Our services include an adult day program, adult day health, which is both a social and medical model, a child care and preschool program, which we've integrated, a senior enrichment center, home-based case management, nutrition and transportation support, community health, caregiver services, kinship care, grandparents as parents, and our weekly farmers market. So a little bit about how we got here, our history. We started out, like most nonprofits, as a small storefront that was focused on recreational activities for older adults. Several years later, the city recognized our success, and we developed a Valley Senior Services Resource Center, which evolved into ONE, the acronym meaning one organization, or the organization of needs for the elderly. In 1994, it's important to note that a drastic shift happened in our mission by adding our child care program, which highlighted our commitment to intergenerational programs. Our services are held at our Joy campus, which is the acronym for Joining Old and Young. So our program integrates the human needs of both demographics through giving and receiving meaningful daily contact. In an effort to reflect this philosophy in our mission, in 2003, we changed our name to One Generation to include all of our programs and demographics. And it should be noted that One Generation is one of the first programs to successfully create an intergenerational shared site with our adult daycare and child care program. Okay, so there has been numerous studies and research that shows the benefits of intergenerational programs. Dr. Shannon Jarrett found that for adults, they unite disparate age groups in quasi-kin relationships, meeting the care needs of multiple generations of families. Research findings showed that seniors with cognitive impairment benefit from activities with children. Their mood, their affect is also improved during the activity, and this remained high for several hours after the activity ended. And for our kids, further research by Dr. Steve Zarrett shows that children involved in intergenerational programs showed higher levels of empathy. They showed no signs of ageism. In other words, anyone of any age could be called a friend. And really important, there was a trend towards delayed gratification, which means toddlers can learn to wait. And what parent would not want that with their child? So why now? Many of our seniors suffer from social isolation, and intergenerational programs help with loneliness, promote health and well-being, and minimize ageism. An intergenerational shared sites and programs benefit the workforce. They build on a range of life skills, as well as attracting and retaining staff who are specifically interested in intergenerational programs, as employees find gratification working with different generations. So what is intergenerational programming? It can refer to any formal or informal interaction between youth and older adults, members of different generations, programs that select and coordinate activities that are mutually beneficial to all participating. So what we have learned at One Generation after doing this for many years, we have our staff members in both programs create and collaborate on activities. They know the strengths and weaknesses, likes and dislikes, and they plan an activity that is fun for each group. Participation is voluntary. Our activities are in a different room, and some seniors, they just really are not interested in interacting with children. That's okay. Participants are prepared ahead of time. For some of our dementia clients, they need to know what to expect. Activities are client-centered, and they reflect those participating. Activities are mutually age and role appropriate. We don't want to infantilize our seniors. Activities facilitate interaction between the groups, art projects, and songs, and it's noted that it does not have to be complicated. So in addition to our most recognized program, which is the Intergenerational Shared Site with our adult daycare and childcare services, we also offer programming that may be more attractive to community-based organizations looking to engage and introduce the concept of intergenerational programming. So basically, your organization can do these programs as well. We have a foster at-risk teen art program, which offers weekly classes held at the Senior Center in partnership with local high schools and foster youth programming. We have parenting teen programming that's a local partnership with continuation schools to provide teen parents with mentorship, life skills, training, and support from an older adult. We have Sages and Seekers, which is a mentorship program between active seniors and high school students getting ready to graduate and transition to their next phase of life. This program develops empathy, stronger communication, and increased confidence for both generations. We have Grandparents as Parents, and it's our kinship care program that supports grandparents caring for or who have custody in their grandchildren or another young relative. We have Letters to Our Elders, which is a great program that we developed during COVID. And what we do is we brought back the concept of the pen pal, where our seniors who are isolated and homebound are paired with a local high school student who's participating in remote learning. And they write letters back and forth to each other. And the mailman is basically our home-delivered meal driver who delivers letters to our seniors. We also have daily telephone reassurance calls that are also conducted by local students, and these friendly calls provide some of the program's most isolated older adults with guaranteed friendly phone calls daily. One Generation's intergenerational program, our main intergenerational program is, like I said, with our adult daycare and child care program. It's incredibly sweet. We provide programming to older adults living with dementia, and our child care program accommodates children 0 to 5 years old. The children call the older adults their neighbors to alleviate any negative stereotypes. We have 3 to 4 classes, typically the older children who visit their neighbors, they call them their neighbors, 8 to 10 times a day for activities, but as stated, they're not required to participate. Participants in our adult daycare also have the opportunity to go to across the way to our child care center and be able to hold and rock the babies. So before I turn the presentation over to Jenna House, I wanted to show some pictures from our intergenerational programming. These are specific images from our adult daycare in which the older adult has developed some type of cognitive impairment. Many of our older adult participants become more alert and engaged, as well as feel an increased sense of purpose and dignity when engaging with their neighbors from the child care program. If you're ever in Los Angeles and want to visit us, it's really a beautiful dynamic to witness. So I will turn it over to my colleague, Jenna House.
Thank you, Lori, and good afternoon, everybody. Thank you so much for joining us. So I'm going to continue on with our presentation here, just kind of give a brief overview of just the statistics for our intergenerational programming, what that looks like on a day-to-day basis. So annually, pre-COVID, of course, we would get to experience an average of about 150 older adults participating in our adult daycare program, with about 160 children participating at any given time. Our teen programs, like Lori had mentioned, participation ranges from around 100 to 150, depending on the semester and the school availability. Obviously, working with more schools can produce more children and youth that are interested, something that we highly recommend. And as explained prior, the benefits of intergenerational programming affect all age groups. For infants and preschool-age children, we've seen improved empathy, cooperation, interactive play strength. For elementary school-age children, we see increased patience, sensitivity, compassion, problem-solving, and accountability. For middle school children, we see improved peer relationships, enhancing reasoning and conflict resolution, and also self-purpose. For our high school children or teens, improved self-confidence, communication skills, increased levels of collective efficacy, and social cohesion. Also, for our young adults and college students who participate in our programming, we see gained skills within the aging field and higher rates of civic and community engagement. Of course, for all ages, we see with intergenerational programming that it reduces ageism and age discrimination among all generations. So while a meaningful and purposeful curriculum designed around bringing together generations is important, interaction and engagement is the key to a successful intergenerational programming. On consideration of how interactions will occur between the generations and that impact on the overall experience is a key factor. There is no need to be fancy. Simple activities can create some of the most positive outcomes. For example, like Lori had mentioned, our Sages and Seekers is an 8-week mentorship program in which local seniors are paired with high school students. It's a weekly, hour-long conversation between the two generations that can develop lasting impressions and benefits for both parties. A simple sit-down conversation that doesn't require an elaborate activity or expenses. And of course, developing a curriculum is important, but being able to flex and adjust activities based on the cues from your group will lead to more successful outcomes. I have some anecdotal quotes from some participants. We have Josephine, who is a caregiver and spouse to one of our adult daycare participants. She quoted that her husband's been attending our adult daycare program, and despite his moderate dementia, continues to remember the children and looks forward to volunteering as a preschool book reader. Your programs have given him a sense of purpose and bring true happiness to his life, and we are so thankful to have connected with such a unique and valuable program. Also, we have on the other end of the age spectrum, Stephanie, who is a college student, and she says, after participating in your Sages and Seekers program over 2 years ago, I continue to keep in touch with my Sage Judy. She is my cheerleader and supporter. As someone who was also raised by their grandparents and had to work hard to go to college, I feel that I have gained a family member with Judy and remain grateful for the opportunity to meet her and gain a better understanding about older generations. So oftentimes when we present on our intergenerational programming, we are asked how other community-based organizations, nonprofits, and other groups can replicate or create their own intergenerational space. So I wanted to take a step back and share with you, in 2021, the Generations United and Eisner Foundation, along with the support and knowledge of local intergenerational shared sites like One Generation, put together a comprehensive toolkit for communities who were interested in developing or enhancing their intergenerational shared sites.
So this toolkit was designed as an online resource representing effective practices, challenges, tips from practitioners, examples, and concrete tools to help plan and implement a high-quality shared site. So first and foremost, what is an intergenerational shared site? These are intentionally designed places that provide services and programs to multiple generations concurrently and foster meaningful cross-age relationships. Using an age-integrated approach, shared sites strengthen support systems throughout entire communities. Shared sites are not just physical places, but they're spaces that have collective meaning for all age groups. Some of the characteristics of shared sites are going to be intentional and ongoing opportunities for intergenerational engagement. These are age-appropriate programming that are inclusive and accommodating, and of course a safe and welcoming place for individuals of all ages. For example, a preschool program that is also age-friendly. And characteristics of a shared site include culture of collaboration between programs and staff to create and plan successful engagement. Staff who are well-versed and understood the core foundation of benefits of intergenerational programming, who also value cross-age connections. For example, at One Generation, our staff members who participate in our intergenerational programming, like our child care and adult daycare, all have some sort of connection and deep understanding of the foundations and benefits of intergenerational, whether it's a personal connection or a professional connection. They are well-versed and have that passion to continue providing intergenerational programming. Also, most importantly, shared values amongst those involved. The buy-in is key. And then some examples of what an intergenerational shared site would look like and what you may have already seen out there. This can include a community care center, child care housed at a retirement community, assisted living, nursing home, or adult daycare, schools and senior housing located on the same campus, centers that serve specific populations such as LGBTQ and people with special needs, co-located senior centers and schools or Head Start programs, and intergenerational co-housing. For One Generation, our shared site consists of the child care and adult daycare program, like Lori had mentioned. So shared sites have proven benefits on multiple levels. As shared a few slides back, the benefits for children can impact social and emotional development, cognitive functioning, and physical activities. For older adults, benefits may include enhanced life satisfaction, self-worth, reduced feelings of isolation and loneliness, reduced feelings of loneliness and depression, and improved perception of health and physical activity. From an organizational perspective, shared sites can allow for increased collaboration across internal departments, potential cost savings through cost sharing, and increased visibility in the community. And of course, for communities, benefits of shared sites will allow for increased awareness of intergenerational relationships and the efficacy of shared sites, new job opportunities, development of new public spaces, and community revitalization. When planning or strategizing around the development of an intergenerational shared site, the toolkit offers a comprehensive guide to assessing and preparing for the incorporation of intergenerational programming. Some of the questions asked in the planning phase can include, what do you think are the unmet needs of those you wish to serve? This can include looking at a local community needs assessment that was conducted by a hospital or health system. Doesn't necessarily mean you need to conduct your own needs assessment, but look and see what's already out there. Also, how can those needs be met by developing an intergenerational shared site? Who might be a partner in this new development? Maybe your existing partners. What are some potential barriers and how to problem solve, address them? Once the planning phase has been completed and you are ready to move forward with the actual design, it is important to continuously be intentional about the space being created. This includes special focal points where different groups can meet and interact, build relationships, and work together. A more detailed breakdown of designing intentionally focused intergenerational engagement is available in the toolkit, which I will provide the link in a few slides. Another key component in the toolkit for One Generation, and as one of the few shared sites, is staffing, of course. The use of intergenerational coordinator will allow for a more successful outcome. You could incorporate or add on job duties to include the development of intergenerational activities to your existing staff, but it is ideal to have a dedicated person solely focused on intergenerational content. Ensuring communication between staff who are working together with your service population. These staff members will be able to provide feedback and drive the direction of the future programming and activities. And of course, knowing the population in which you are serving is critical. Ensuring staff who are knowledgeable but also passionate about their work and those they serve will create a more positive experience for everyone. Meaningful intergenerational engagement is at the core of high-quality intergenerational shared sites. Think about how you can create both structured activities that intentionally promote authentic cross-age exchange and opportunities for informal interaction. These characteristics can include a person-centered model, focusing on interaction and the process of building intergenerational relationships instead of the activity itself. Not a single isolated effort, but part of a continuous process connecting multiple activities. Also activities that are participant-driven and developmentally appropriate for all activities and for all ages and generations you're working with. Now, I very briefly and quickly went over some of the toolkit highlights that I thought were most relevant to today's presentation. However, I do highly encourage everyone to check out the toolkit in its entirety, as this is a free resource that can be very helpful if you as a community-based provider are looking to incorporate intergenerational activities or even possibly a shared site within your community. So I have the website here. It's very simple, sharingyourspace.org. And that is it. Here's our contact information. If you have any questions or would like to reach out, I will turn it over. Thank you.
Great. Thank you so much to all of you for your wonderful presentations. There's a lot of fabulous information shared. If you have questions, you can enter them into the question and answer pod on your screen. I know quite a few questions were asked during the presentations, and some of them were answered in writing. I will be asking some of those key questions just to make sure everyone hears the responses, since it's sometimes people miss the written ones that are answered. So take some time, ask your questions, and I will start by addressing the first question to Al Castro and Melinda Cavanaugh. The first question was asking, stating that the social research on caregiving indicates that Latinx communities don't really think of caregiving as anything except a family responsibility. Can you talk a little bit about the terms that work for you in the work you were reporting today and more generally with the Latinx communities?
Sure. This came up probably about 2007 when we started creating these programs because the word does not translate. Caregiver does not translate in Spanish. It's a term that comes from the outside, you might say, that we've had to kind of fudge internally to, as we write program descriptions, whatever. We use the term loosely, cuidador, which kind of means the carer, caregiver. But in reality, when we're talking to family members, we refer to them as taking care of their loved one, cuidando su ser querido. It's sort of more of an, I guess, an action description, you might say, for lack of a better term. But yeah, if we use the word caregiver or cuidador, it won't resonate with them unless you explain it in context. So it's better to approach it from the role that they play and the action of it itself. Does that kind of make sense? And yes, the second part of the question is a very good one. Yes, that there's a strong sense to want to provide everything we can as a family within our family system. The familismo tends to refer to the sense of the identity with our family, everything's centered around the family itself and the importance of the family over the individual. That's that collective sense that we have in our culture, which has been a strength for generations in our culture that helps our community be resilient, you might say. However, that can also be a barrier to those of us that are social workers or try to do interventions, because sometimes when the family really does need help that they can't meet it themselves, that's something we do run into and can make it harder for the family system to accept help from the outside when it's really needed. I've seen those cases where maybe one caregiver, like the youngest daughter or the oldest, is getting ready to burn out, and she would like outside help, and there's pushback from the family. because there's that expectation that, well, we got to keep this care in the family, or that's kind of your job as the daughter, et cetera, et cetera. It's a conversation by other Latinos that look like them and talk like them, which is our team, and just having a conversation to process that with them. It's not a one and done. Sometimes it's a process because you're going against the grain, you're going against generations of a cultural norm, you might say. Not so much the case if a family's more acculturated, born and raised here, maybe second, third, fourth generation. We tend to see that norm more in the first, second generation of family, but it's a very real one. So it takes a conversation, and it helps to have the message of being a Latino or Latina. I hope that helps.
Excellent. Thank you so much. The next question, Lori and Jenna, you might be able to touch on this. I know that you had some creative solutions on adapting programs during the current pandemic. Can you talk a little bit about how COVID-19 impacted your programs, workarounds that you conducted and devised in order to continue some of the programming?
Yeah, absolutely. It's a great question. I know that it's on a lot of people's minds. The experience of COVID definitely allowed us to think outside the box as creatively as possible, because we wanted to ensure, while of course getting essential services to our aging community, we also wanted to incorporate intergenerational programming. At first, our adult daycare program was shut down for in-person activities, and we were able to incorporate a variety of different intergenerational events, such as a drive-through parties where the seniors were driven by their caregivers and their neighbor children were outside waving to them, and we were giving the participants goodie bags and different activities that they can do at home, such as puzzles and coloring books and appropriate activities for their cognitive status. The child care program did not close down and was not affected by COVID, so we wanted to make sure, since we still had the children on site, that we could incorporate anything that we're doing with our seniors. As time went on and we became a little bit more familiar with COVID, we then converted and switched over to a virtual model where we conducted intergenerational programs via Zoom. Each classroom was provided with a tablet where they were able to participate in the different exercise classes, in bingo, depending on the age of the classroom, of course, and then different book readings and different activities via Zoom. We are still doing that to this day, even though our daycare program has reopened to limited capacity. We want to make sure that for those participants who aren't able to come to the center, that they're still able to not only engage with the services that we offer, but also participate in intergenerational programming. We are slowly getting back to re-engaging in person outside with our neighbor children and our seniors, and hope to continue to offer both a hybrid virtual and in-person intergenerational program moving forward on a permanent basis for seniors that aren't able to come to programs like our adult daycare.
Great, thank you so much. I'd love, Al and Melissa, if you could, did someone want to add to that? Okay. So I would love if you could answer the question about the UCC programming, how you talked about being a family caregiver with children. It might not be something that was a known term to them. Maybe it was just something they did routinely. Can you talk a little bit about that?
Yeah, I'll take that. And it's interesting because it's not something that's really just exclusive to the Latino community, but in general, and this is really borne out, across years of my research, children and youth don't really identify with that term caregiver, much like how Al was saying how it really resonates or doesn't resonate in the Latino community. It doesn't really resonate with children and youth either. It tends to be much more of an outsider or an academic term. So when we're talking to the kids, we're talking about what are things that you do to help? How can you, what does your family member need? Or what are things that you do to be involved? So, we kind of use different phrases or different wording to help them understand what we mean by caregiving as a very prescribed word. But once we do talk about it and give some more context, then they really do jump in and they're like, oh, yes, I do any number of things. But to just start right out and say, are you a caregiver? And so, as an example, in the Latino survey that we did with the 4th through 8th graders, we didn't use the word caregiver. We asked, are there things that you do to help out a family member? Are there things that you do to assist or, be involved in someone who has an illness, so that we didn't use a very forced term on them.
Great, thank you so much. Very helpful. Another question that came up that all of you may be able to shed some light on about tips for engaging and supporting children during home visits that are related to hospice or even, care management visits, so that children understand what's going on a level that works for them. Do any of you want to comment on that?
Melinda, you want to start with that one? That's kind of your area too.
Wait, yeah, no, I'm sorry. Would you just rephrase that really quickly again, Sarah? I'm sorry.
Sure. No, that's fine. Someone's asking about tips on engaging and supporting children during home visits for maybe they live in the home of someone who is living with dementia and it's a hospice visit or a care management visit, so that they understand what's going on in a way that works for them on a child level.
Absolutely. There are a lot of tips. That's a really big question, and quite frankly, like an entire webinar just on that. I would say that first and foremost, not being afraid to answer their questions. Sometimes healthcare providers, and particularly around the end of life, people want to dance around it and not just be honest with children, making sure that the parents know that if the child has a question, that you're there to be able to answer and support them. I would also really look up, there are quite a few excellent resources for children, particularly around end of life. There are lots of grieving resources that are available online and written, so that it might be something that children are prepared for, that they have a book ahead of time, or that the family has links to information ahead of time. It's definitely about being very honest and not using words like what we were just talking about, like, are you a caregiver? But not using words like necessarily, passing away. Those things are kind of vague, particularly for younger children. So, being honest, being available, making sure the parents are engaged, and finding as many written and accessible resources so that the family is prepared. And we see this a lot with COVID, with a lot of families who are feeling doubly isolated because they aren't able to get out and about. So really, going online, the Alzheimer's Association, the ALS Association, there's grievingchildren.org. There are a lot of really great resources that I highly encourage, folks to really reach out and have available at their fingertips when they're going into doing home visits.
The one thing I would add to that, very good, Melinda, is the kids are there anyway, especially in our families. They're all, you show up at the house and everybody shows up. So always just remember to ask, out of respect to the elder, their permission, can this, it's okay to your grandson to sit in, or granddaughter, or whatever. Just asking that permission. And it usually always is, but it's just respecting the family dynamics there, that is it okay? Because they're involved anyway. So just recognizing that the hierarchy of respect, the elders. But yeah, they're usually there anyway.
Great, thank you for that addition. Very helpful. Well, at this time, we are going to close out the webinar. I want to thank all our presenters for their fantastic presentations today, and thank you to all our participants for joining us at our National Alzheimer's and Dementia Resource Center webinar series. We'd love to have you again at our next webinar on February 24th. It will be focused on dementia training for law enforcement personnel, building partnerships to enhance community safety. We hope you will join us again. I will turn things back to Julia Burrows for some final remarks.
Thank you again so much, everyone, all of our speakers and presenters today. We really appreciate your time and your efforts. We thank NADRC for your partnership. I do want to remind everybody that you will be receiving a follow-up email by the end of the business day that will contain a link to the CEU application. It will also contain today's slides, so if you had some issues saving those, you will get that in an email form. Please note that you have 60 days to claim those CEUs, and it may take up to 30 days for us to process your CEUs. Thank you so much again, and we hope you'll join us soon. Take care.